So responsible innovation is the future of health technology. So historically, health technologies are developed using sort of two things really. So they look for efficacy, whether they're doing their job properly, or they're looking through a health and safety lens when they're developed. So they're looking at whether they harm people and how to mitigate that harm. But responsible innovation takes those two and broadens this perspective. So it looks at things through a social and an environmental lens. So looking at it from a health systems perspective, what are the other challenges and opportunities of implementing that technology? So do we need to create a new kind of workforce to support that health technology? Are you actually taking a particular skill set out of the workforce by implementing that technology? So are people going to lose their jobs? But also on sustainability and environmental sustainability. So thinking about where we have designed health technologies from inception, thinking about the end of life of those devices, and also where there have to be single-use devices, thinking about the material composition and decomposition. So we're much more familiar from the onset and from the design of these things what the wider environmental impact will be in the longer term. So it's much more appropriate framework for design and development and innovation of health technologies that meets the needs of our planetary health now. So what we're trying to do in responsible innovation is support a resilient healthcare system. Now in the UK that means lowering costs, that means job stability, and that means getting the best care to everybody. But healthcare isn't just a UK thing, it's global. So there are various healthcare systems who require health technologies to address the same clinical problems, but very different resource limitations. And so health technology should be developed with that wider context in mind, not just high resource settings, but also low resource settings as well. And that makes the economic model and viability of companies and startups much more broad in terms of the reach that they can make. In Southampton, we're creating a healthcare-specific incubator accelerator with a new type of master's programme embedded within it. And a central tenet of that master's programme and the healthcare incubator accelerator is the Responsible Innovation in Health Technology, which has the gorgeous acronym of RIHT. Okay, so these RIHT principles underpinning all of the stuff that we are able to support, the kind of companies that we want to attract to the area, the kind of students and graduates that we want to work with who are cognizant of the wider impact of health technologies, not just within the healthcare system, but also in terms of the environment, in terms of financial sustainability, and how do we take a technology and transfer it from the UK into Sri Lanka, for example, to address the same clinical problems. So looking at things through resource-restricted contexts as well. So the Healthcare Incubator Accelerator, what we want to do here is create an ecosystem which supports innovators across the UK but is housed within the Wessex region, looking at a place that people will seek out to look at and working with academics, working with clinicians who are cognizant of the wider innovation landscape, who are working on real-world problems to address absolute real-world and global challenges in healthcare, but are also cognizant of those wider socioeconomic considerations and environmental considerations of impact into the green agenda for the NHS. This is really exciting because it provides the building blocks for a really interesting, bright, sustainable future for healthcare.